Lovely.
Oh.
Okay, Mani?
Yeah. Yes, go ahead. I'll just mute everybody. Yeah. You have to unmute yourself. Sorry. Yeah.
Oh. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Param Tasmai Shri Guruve Namah. Sarva Mangal Mangalye Shive Sarvarth Sadhike Sharanya Trambake Gauri Narayani Namostute Narayani Namostute Narayani Namostute. Shri Ganeshaya Namah, Shri Ganeshaya Namah, Shri Ganeshaya Namah. बोलिए पवन सुत हनुमान की जय। सबसे पहले आज मैं आपको शोक की बात सुनाने जा रही हूँ, जो अभी भी मैंने आस्था चैनल पे देखा। हमारे जो स्वामी मुक्तानंद जी थे, उनका निधन हो गया। It was very shocking news this morning when I watched our Swamiji Ramdev Ji Maharaj. He gave lovely Shraddhanjali to Swami Mukta Ji Maharaj, and for your information, there are three people working: Swami Ramdev Ji, Acharya Balkrishan Ji, and Muktanand Ji. They had a company for the last 35 years together, and he was the one who was looking after all these flowers and various other activities going on in Patanjali, phase 1, phase 2, Yogram, and the new our wellness center. This is a very sad news for us today. Swamiji was quite upset. I could see that. So आज का ये जो प्रोग्राम है, I am giving श्रद्धांजलि to स्वामी मुक्तानंद जी। हनुमान जी की करेंगे चालीसा और उनकी आत्मा की शांति के लिए हम समर्पित करते हैं। He has done such a good job. सेवा, निष्काम सेवा. He was hardly seen. He was working at the background. चलिए, बड़ी श्रद्धा के साथ, बड़े प्यार के साथ, अपने मन को समाहित करते हुए हनुमान चालीसा गाएंगे। Once again, thank you very much giving me this service. जो प्रभु इच्छा, जो प्रभु इच्छा। बोलिए पवन सुत हनुमान की जय। श्री गुरु चरण सरोज रज निज मन मुकर सुधार, वरनो रघुवर विमल जस जो दायक फल चार, सियावर राम जय जय राम, मेरे प्रभु राम जय जय राम। बुद्धिहीन तनु जानिके सिमरो पवन कुमार, बल बुद्धि विद्या देव मोहि हरो कलेश विकार, सियावर राम जय जय राम, मेरे प्रभु राम जय जय राम। जय हनुमान ज्ञान गुण सागर, जय कपी सतहि लोक उजागर। राम दूत अतुलित बलि धामा, अंजनी पुत्र पवन सुत नामा। महावीर विक्रम बजरंगी, कुमति निवास सुमति के संगी। कंचन वरण विराज सुवेशा, कानन कुंडल कुंचित केसा। हाथ वज्र और ध्वजा विराजे, कांधे मूंज जनेऊ साजे। शंकर सुमन केसरी नंदन, तेज प्रताप महा जगवंदन। विद्यावान गुणी अति चातुर, राम काज करबे को आतुर। प्रभु चरित्र सुनने को रसिया, राम लखन सीता मन बसिया। सूक्ष्म रूप धरि सिए दिखावा, विकट रूप धरि लंक जरावा। भीम रूप धरि असुर संहारे, रामचंद्र के काज सवारे। लाए सजीवन लखन जियाए, श्री रघुबीर हर्षे उर लाए। रघुपति कीन्ही बहुत बड़ाई, तुम मम प्रिय भरत सम भाई। सहस वदन तुमरो जस गावे, अस कह श्रीपति कंठ लगावे। सनकादिक ब्रह्मादि मुनीषा, नारद सारद सहित अहिसा। यम कुबेर दिगपाल जहाते, कवि कोविंद कहि सके कहाते। तुम्हें उपकार सुगरी वही कीना, राम मिलाए राजपद दीना। तुमरो मंत्र विभीषण माना, लंकाश्वर भय सब जग जाना। योग सहस्त्र योजन पर भानु, लीलो ताहि मधुर फल जानु। प्रभु मुद्रिका मेली मुख माही, जल्दी लांग गए अचरज नाही। दुर्गम काज जगत के जेते, सुगम अनुग्रह तुमरे तेते। राम द्वारे तुम रखवाले, होत न आज्ञा बिन पैठारे। सब सुख लहे तुम्हारी सरना, तुम रक्षक काहू को डरना। आपन तेज समारो आपे, तीनों लोक हाँकते कापे। भूत पिचाच निकट नहीं आवे, महावीर जब नाम सुनावे। नासे रोग हरे सब पीरा, जपत निरंतर हनुमत बीरा। संकट से हनुमान छुड़ावे, मन कर वचन ध्यान जो लावे। सब पर राम तपस्वी राजा, तिनके काज सकल तुम साजा। और मनोरथ जो कोई लावे, सोई अमित जीवन फल पावे। चारों युग परताप तुम्हारा, है प्रसिद्ध जगत उजियारा। साधु संत के तुम रखवारे, असुर निकंदन राम दुलारे। अष्ट सिद्धि नौ निधि के दाता, असवर दीन जानकी माता। राम रसायन तुमरे पासा, सदा रहो रघुपति के दासा। तुमरे भजन राम को पावे, जन्म जन्म के दुख बिसरावे। अंत काल रघुवरपुर जाई, जहाँ जन्म हरि भक्त कहाई। और देवता चितना धरिए, हनुमत सेव सर्व सुख करिए। संकट कटे मिटे सब पीरा, जो सुमरे हनुमत बलबीरा। जय 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 हनुमान गोसाई, कृपा करो गुरुदेव की नाई। जो सत बार पाठ कर कोई, छूटे बंदी महा सुख होई। जो ये पढ़े हनुमान चालीसा, होए सिद्ध साखी गौरीशा। तुलसीदास सदा हरि चेरा, कीजे नाथ हृदय में डेरा। पवन तनय संकट हरन, मंगल मूर्ति रूप रामा। मंगल मूर्ति रूप राम लखन सीता सहित, हृदय बसो सुरभूप सियावर। राम जय जय राम, मेरे प्रभु राम जय जय राम। मंगल भवने अमंगल हारी, उमा सहित जय जपत पुरारी। जय सिया राम जय जय सिया राम। बोलिए पवन सुत हनुमान की जय। थैंक यू वेरी मच एवरीबॉडी।
Thank you, Dr. Kapur. That was lovely. I'll pass it on to Thakur.
Thank you very much, Dr. Kapur. Yes, we saw the message today of Guruji who passed away, and it was a very sad news. हमें बहुत अफसोस है कि गुरुजी आज हमारे साथ नहीं है, मगर हम प्रे करते हैं कि उसकी आत्मा ने प्रभु शांति दे। हमें तो सौभाग्य नहीं मिला उसको मिलने का, मगर जब ये समाचार आपने जो डिस्क्राइब किया कि उसका जो योगदान है पतंजलि में, तो इट्स रियली वेरी वेरी ग्रेट। एंड when people like him we miss them, it's a great loss for Patanjali। और उम्मीद है कि बालकृष्ण जी और बाबा जी को हिम्मत दे और उसको प्रभु की आत्मा को शांति मिले, वो हम सभी की प्रार्थना है। So, आपने मिला उसको, गुरु जी को मिला था आपने?
Dr. Kapur, can't hear you.
Yeah.
हाँ जी,
या आप
बहुत टाइम पहले मिली थी, इस बार मैं नहीं मिली क्योंकि वो हार्डली ही सीन, ही इज इन द बैकग्राउंड ऑल द टाइम।
That's right, because we also,
और मैंने उनको फूलों में देखा है, तरह तरह के फूल, कभी भी कहीं भी ऐसे फूल आपको नजर नहीं आएंगे। अदर थिंग ही वाज डूइंग अबाउट द क्लीनिंग, वो जगह इतनी साफ है। आई हैव टू वेरियस अदर आश्रम आल्सो दिस टाइम आई कुड कंपेयर। मैं उनको साष्टांग दंडवत करती हूँ, द वे दे आर मेंटेनिंग ऑल द प्लेसेस, so clean, so clean.
It's
Credit
wonderful.
goes to Muktanand ji Maharaj. He was the one.
Yeah.
He was the one.
नहीं, अब ये जो है ना सब कुछ, अब हमको तो बहुत इतना कांटेक्ट नहीं है पतंजलि के साथ। आप जैसे आप है, श्रवण जी है, दर्शन जी है, वो लोगों को चालू कांटेक्ट होता है, तो we get news from all of you. That's where we try to find out. But I think it's very nice. Sara अभी का जो the whole atmosphere over there is absolutely out of this world. And जब जाते हैं वहाँ, मैं एक दफा गया था, बहुत पहले गया था, but now I'm planning to go again and hope to see, because lots of improvement has been done. So whenever you get opportunity, please go to Patanjali and do visit the place. Is great, you know. So आज का सेशन हमारे मोहन भाई शर्मा जी आने वाले थे, मगर he is not coming today. Maybe he will arrange some other time, but we'll have to continue our session today. So we'll start our program today. So प्रार्थना से शुरू करेंगे। प्रार्थना तो हो गई है, मगर let's start our normal प्रार्थना. So we'll start with 3 times Om. We have, okay. तो हम अपना सेशन शुरू करते हैं। तो हम भस्त्रिका करेंगे। पहले ज्ञान मुद्रा में बैठकर डीप ब्रीदिंग, बैक स्ट्रेट, जितना हो सके इतना डीप ब्रीदिंग करें। तो 30 सेकंड। नेक्स्ट हम आदि मुद्रा में बैठकर फेस करके अगेन 30 सेकंड भस्त्रिका। And the last one we'll do मुट्ठी ऊपर निकलनी चाहिए। So we'll do भस्त्रिका again. And relax. So this is just to energize ourselves. So we'll now do नाइट्रिक ऑक्साइड के लिए हम हमिंग करेंगे 5 टाइम्स और नाइट्रिक ऑक्साइड की एक्सरसाइज करेंगे। इट्स अ वेरी गुड एक्सरसाइज एज नाइट्रिक ऑक्साइड। मनी जी ने कई बार आपको नाइट्रिक ऑक्साइड के लिए समझाया है। तो आई होप एवरीबडी नोज व्हाट नाइट्रिक ऑक्साइड डज। इट आल्सो हेल्प to get more oxygen in our bloodstream and also help nitric oxide to go through our small veins, expand them so the blood flows very freely inside our nerves. But nerves बहुत बारीक होती है. So when the nerves expands, the flow of blood goes very fast. So that will reduce our blood pressure. So nitric oxide ये जो exercise है, which is a very good exercise. So everybody should do it every day. So first of all, we do 5 times humming. ऐसे palm ऐसे करके कान बंद कर, we breathe in deep, do 5 times humming. Okay, so breathe in. Last time. अब हम थोड़ी एक्सरसाइज do it standing up. Those people who are sitting down, जो बैठे हैं तो बैठ करके भी ऐसे कर सकते हैं एक्सरसाइज. So those can do standing up. Do the standing up exercise. So sorry exercise you have to do 20 times to get the full benefit. So do a squat 20 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Next one is a dead man's walk. Straight stand. जो बैठे हैं तो बैठे बैठे करें. So we start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Next one is a dead man star jump. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Next one is a lifting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. So that's one set. So we repeat now. Same set again 20 times. Squat. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. If you feel tired, don't worry, just relax, take it easy, and take rest. So nothing to do forcefully. अपनी बॉडी के हिसाब से एक्सरसाइज करना. जो थक जाए बैठ जाना. Don't worry. So next one is dead man walk 20 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Dead man star jump. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Next one is a lifting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And relax. Normally, if you do 3 sets, that would be quite nice.
Group up the breathing. You can just do tight.
So when you finish, you can have a deep breathing. So breathe in and breathe out. Breathe in and breathe out. Breathe in.
Are we doing?
So that's the set of our nitric oxide. So we can now, if you're tired, you can take a rest. We can now continue with our yogic jogging. So we'll all set together. So nothing, just do as much as you can. The body के हिसाब से करना. If you have a high blood pressure, don't do it. Do it very, very slowly. If you are suffering from any problem, don't do it. These are just jogging normal exercises to keep you fit. Yeah. जितना हो सके इतना. You do it as much as you can. जितना हो सके इतना ही करना. Next, you turn around. Yeah, turn it on your right probably, and bend and look straight up. Again, breathe in, breathe out. Breathe in and breathe out. Breathe in and breathe out. Next one, you can do it that way as well. Breathe in, breathe out. Breathe in, breathe out. Breathing in and out is very, very important. That's time. Next one is you can hold your hands and raise it and go down on your left, on your right, left again, and relax. Next one,
Into the new one.
new one, yeah, okay. Knee को move करें clockwise. You can do it about 5-10 times. इतना हो सके इतना क्योंकि घुटने की तकलीफ सभी को है. So you have to do it very, very gently. If it's painful, don't do it. Reverse. 2, 3, 4, 5, 6, 7, 8, 9, and 10. थोड़ा सा wide कर दे पग. Then open up and move forward. 2, 3, 4, and 5. Reverse. 1, 2, 3, 4, and 5. Next one, we have to widen our feet. 3, 4, 5, 6, 7, 8, 9, and 10. Next one, you widen your feet. So we are going to bend down on your right first, okay? On your right side, hand straight, and try to keep your hand in line with your ear. इधर का stretch होना चाहिए, no? Stretch आवाज आवाज जो है, that starts to be stretch. If you do it like this, there won't be any stretch. But if you do it like this, a proper stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Next one, we have to come down. Right hand touches left toe, left hand touches right toe, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. When you come down, you breathe out. When you come up, you breathe in. Always. When you come down, breathe out. If you have back pain, don't go down too much. And if you have hernia problem, don't go backwards. Okay. So the next one is you have to go back, touch your toes, come up, breathe in, and breathe out. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Lovely. Excellent. Next one is a star jump. So we do it slowly to start with. From here, start with right. Next. 3, 4. 1, 3, 4. 1, 2, 3, 4. You can do it as much as you like, but make sure that because this exercise is very tiring, so you always want to take a rest. So we'll do it 15 times fast. But if you can do it 5 times or 10 times, it's fine. If you can't jump, don't jump it. Okay. We'll start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. You can do it 20, 30 times or up to 1 minute, depends. So the next one,
Tadasana.
Tadasana. Lock your hands on your head and hands straight and just stand on your toes. Stand there for a few seconds. Breathe out and come down. Breathe in and go up. Last time, breathe in and down and relax. Oh, so another one here. Widen your legs. Go on your right. Breathe in, come up. Breathe out and go on the other side. Breathe in. Breathe out. Again, breathe in. Breathe out. Come up and relax.
We'll do that.
Next one is a twist.
Oh, you're going to twist it.
And relax. These are all very
And do that.
tiring
Doctor,
exercise.
can we do
So
that? Finish.
move your waist.
Oh, it's okay. As long as we
Very
do
nice.
it.
Right. All these exercises are quite good. Make your whole body flexible. And reverse. इस उम्र में we all need our body flexible, very, very flexible. But at the same time, you must take care as well. Right. So we will turn our hands. Breathe out, breathe in, breathe out, breathe in, and breathe out. Breathing in and out is very beneficial. Next one is you take your left hand back, right hand on your left shoulder, and look back and turn around. And relax. So that's our Yogic Jogging. The next one is the Surya Namaskar, which Mani Ben will do the Surya Namaskar and I'll do on the chair so that those people sitting on the chair can take advantage. Okay.
Whenever you're ready. Again, it's a lot of stretching, so do what you can, like biceps. So we do 12 steps. So if you come at the end of the mat, if you're standing up doing it, so namaste. And then breathe in, raise your hand, then bend back. Number 2. Number 3, breathe out, come down, and then put your hand beside your feet. Then you breathe in, take the right leg back, and you're looking up. Number 4, take the left leg back, and you breathe out. Number 5 is a mountain position. You come in here. And then number 6, put your knees down, and you breathe out again. And then your chin and your chest. Then you breathe again and come to number 7, Ujjasana. Looking up. Breathe out to number 8, mountain position. Number 9, bring the right leg back as you breathe in. You breathe out, bring the left leg forward. Number 10. Number 11, you breathe in, come up again. Raise your hand back and come back. Namaste. Number 12. We do the left leg. We do the numbers. 1, 2, 3, left leg back. 4, 5, 6, 7, 8, 9, 10, 11, and 12. Again, right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Do you want to do one more time or is it okay?
Yeah, do one more time. Just
Okay.
to, yeah.
1,
1,
2,
3,
3, right leg back, 4,
4, 5,
5, 6,
6,
7, 8, 9, 10, 11,
and
12.
12.
We
Lovely.
do left leg.
Yeah.
1,
2,
2,
3,
3, 4, 5, 6, 7, 8, 9, 10, 11, and 12.
12. Lovely. Excellent. I hope everybody has done it. That's good. So we all sit down comfortably in whatever position you want to sit down, but Sukhasan or Siddhasan. And we'll do some pranayam now. So in your Gyan Mudra, we'll do Prastika for 1 minute. It's always a good thing to remember about our pranayams that Prastika, Anulom Vilom is quite safe for everybody. Kapalbhati is a little bit of difficult thing. Those people who has got high blood pressure should not do it Kapalbhati very fast. They can do it very, very gently. People, pregnant lady or who are having a periodic pain, they should not do it. Those people who have got operation within last few months should not do it for at least for 6 months. So Kapalbhati is very, very important. Anulom Vilom, you can do it any times. You can do it after eating as well. But other exercise, other pranayam, you should not do it if you have eaten anything. Keep your stomach empty for at least 4 to 5 hours. But all these pranayams are very, very useful. Everybody should do it whenever you get time. Minimum 2 minutes to 5 minutes is a good time. Anything over, that will depend upon your ability and your what type of things you're suffering from. So for our normal people, 2 to 5 minutes for all these pranayams are very good. So you have to make sure it's your body, and you have to understand how you can cope with your exercises. So in Gyan Mudra or Vayu Mudra, whichever is comfortable to you. So we do Prastika for about 1 minute. So we start deep breathing and breathe out in a relaxed sort of mind. So deep breathing. You're taking 10 times more oxygen in your body. Deep breathe in and deep breathe out. Fill your lungs totally with oxygen and breathe out. Deep breathe in and breathe out. And relax. ये भ्रसिका, when you're when you're sleeping, when you're tired all day, you're working very hard. When you're tired, when you go to sleep, and when you watch these people sleeping, what they actually do, they do deep breathing. जब कोई सोए हुए आदमी होता है तो जो थके हुए आदमी सोते हैं तो they take deep breathing सारी रात 7-8 hours he's just doing prastika in his own sleep. So you can imagine when he gets up in the morning, he is very fresh because he has done all this prastika all night, taking lots of oxygen inside. So whenever you see any man or a person sleeping in a deep sleep, and when you notice it, he's just breathing in, breathing out, breathing in, breathing out. So how much oxygen he's taking. So it's very good exercise. If you do it first thing in the morning, excellent thing. So next one we'll do Kapalbhati for about a minute. So normally I do Kapalbhati in Vayu Mudra. And we sometimes do everything in money when we'll show other mudras. But I think for at least for 1 minute, you must sit in that position and do Kapalbhati. Kapalbhati, you do it very, very slowly for people who are suffering from high blood pressure. Just very slowly like this. Very, very slowly. But normal speed, you can do it normal speed for 1 minute for a normal person. You can do fast, but doing fast is not very good for everybody. It's only for those people who are very healthy and you can do very, very fast. Baba Ramdev ji, when he does like, it's very, very dangerous for us old people. So just do it gently. In Vayu Mudra will help in all your joints, Vayu related problems, especially for joints. So we'll do it Kapalbhati for about a minute. Do it for 200 times. Just count in your mind. Do it for 200 times. Okay. Let's start. relax. 2, 3, 400, 500 times તમે કરશો તો it will be more beneficial. So the next one is Bahya Pranayam. Bahya Pranayama, what we do, you deep breathe in, breathe out, pull your bottom up, close your Uddiyana Bandh and Jalandhar Bandh. You have to lock that, lock here and lock that. So, and then hold your thing as long as you can and then relax. Okay. So now people who have high blood pressure should not do it. They can do Anulom Vilom while they're doing this. And pregnant ladies should not do it. And those who got stomach pain, don't do it. So we do it 3 times, Bahya Pranayam. Because what you are doing here, the 4 system here, you got digestive system, your respiratory system, and your nervous system. Thrown together, we are locking them up. And then we start them with oxygen. Once you release oxygen, everything will start working again properly. So you get exercise of all these 3 elements here. So we breathe in deep, breathe out, pull your bottom up, Uddiyana Bandh and Jalandhar Bandh. Lock all 3 bandhs and hold it as long as you can. And if you can't hold it, just open your Uddiyana Bandh, Jalandhar Bandh, Uddiyana Bandh, and relax your bottom. So again, one more time, breathe in, breathe out, pull your bottom up, Uddiyana Bandh, Jalandhar Bandh, lock it up, and then release your Jalandhar Bandh, then release your Uddiyana Bandh and Mool Bandh. Last time, breathe in, breathe out, and relax. Next one is Agnisar. Agnisar is a Kriya. Even Kapalbhati is also a Kriya because you're moving your stomach in and out. And here, Agnisar is also a very good Kriya for moving all your organs inside your body. So what you do, breathe in deep, breathe out totally, and move your stomach in and out, in and out, in and out, as long as you can. So, okay, so we do 3 times. Breathe in, breathe out, again, breathe in, breathe out, last time, breathe in, breathe out, excellent. So now I asked Maniji to do different mudras, the short form, and see which one,
Okay.
which is the next one you see, and then you can do some other vyayams.
Oh, okay. So we do Kapalbhati. So Kapal means forehead and Bhati means glow on your face. And Kapalbhati will help you straighten your lungs. It's also exercise your internal organs so they can function better when you do Kapalbhati because it's a forceful breathing out and then you're filling the lungs at the same time. So overall is very good. And also it reduces the fat around your tummy and around your waist. So it's a one second, one stroke, 1 second. So you're doing about 60. So like Takobai said, all the health and warning we had. So we're going to start with Udan. So Udan Mudra is all your fingers touching the thumb and the little finger comes up. And then you put it over your shoulder. And this is good for your thyroid and stamina and also for your voice. So we're going to twist that, give you more benefits because it's going to help you exercise your internal organs. So we can do for 30 seconds. and relax. Next, we will do Vayu Mudra. Vayu Mudra is good for the gout, arthritis. There is also some other disease that is good for, and also for your if you got a lot of gas formation in your stomach, so it's good for the digestive system. So we do that. And relax. Next, we do Prana Mudra. Prana Mudra is your little fingers and index finger together. And prana is life energy, so it gives you a lot of energy. Also increase your immunity as well, and also good for the eyes. So if you are doing the eye exercise, this is good as well. Do this while you're looking at the diva. So we do Kapalbhati for 30 seconds. And relax. Next is a Apna Mudra. Yeah, and put it at the side, and we're going to twist, and this is to release all your toxin from your body, from your liver, from your kidney, from your lungs, and from your stomach. And relax. Next, we will do Surya Mudra. Surya Mudra is your ring finger pressing against the thumb. And this is also good for the weight loss, you lower your cholesterol levels, good for the diabetic people, and all liver-related problems. And relax. Next, we do Apna Vayu Mudra. So this is
Apan Vayu Mudra.
Apna Vayu Mudra, yeah. So index finger press, and then your two fingers touching the thumb, and then your little finger stays up. And this is good for the people who got a high blood pressure, if you got any heart problem, and if you're going up the stairs, this is good. It will relieve the pain. I use this mudra when I go up the stairs, when climbing the hills, and when I'm going to see all the castles. You go up the castle because the castle steps are very, very steep. So it's very good using this, and it does work. Like Sarvanji said, put your mind to it, which mudra is suitable for you, and it will work.
Because this mudra especially when you're climbing the stair. What you do normally, if you do it 2 minutes to 5 minutes before you climb up, is much more benefit, because when you're climbing, you want to hold something, so you lose your mudra. So do it for 5 minutes before you want to climb up a mountain or somewhere. Then it's much more beneficial. So, but it's very, very good for climbing. Yeah, it's good.
If you can balance it as you go up, then it's then
Yeah.
it's very good. The next one is a Varun Mudra. Varun Mudra is your index finger touching the thumb, and this is also good for your skin and for the allergies. And relax. Last, we will do Linga Mudra. Linga Mudra is for the low blood pressure, also people with asthmatic and any lung problem, also for the heat. And relax.
So we stretch our legs now.
Grinding.
Yeah, because you're sitting for so long time, so you always want to relax a little bit. Yeah.
Right. Got pins and needles. So we do the leg exercise first before grinding?
Yeah, do the leg exercise.
Yeah. So we give the massage.
Legs are very, very important. So you must be
Put our,
taking care of legs all the time.
put our hands on the knees and then breathe in and out. And relax. We're going to move our toes. This is a good exercise for the gout, arthritis. We do more often. Gout is building up of uric acid in your kidney. When it builds up, it causes a lot of pain, swelling, inflammation. So this is help you to relieve the pain. So then you breathe in, bring your toes forward, then breathe out. Do 10 times. And relax. And then we rotate. 1, 2, 3, 4, 5, 7, 8, 9, and 10. Reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And just tap it, your knees, and exercise lower part of your body, all your hip, and then do vipers. Then you can see vipers. So you're moving your hips, your exercise, your thighs, your knees, and your calf muscles, and your ankle, and your toes. So all in one. Next, we'll hold it, support the knee, and then we go up 5 times. We do up 1, 2, 3, 4, 5. Rotate 1, 2, 3, 4, 5. Reverse 5, 4, 3, 2, 1. Cycling 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And relax. Each is enough. 1, 1, 2, 3, 4, and 5. 1, 2, 3, 4, 5. Reverse. 1, 2, 3, 4, 5. Cycling. 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And relax. And then other leg, one leg straight, right leg over the left side. And we're going to exercise the knee. So you breathe in, bring your right knee up, hold it a few seconds, and then come down. People who can't do it all, you just put it at the side and do it this way. Do it 3 times. Last time. You can do more in your own time. Then we're going to rotate the ankle clockwise and anti-clockwise. This is help to reduce the swelling in your leg, exercise your joint as well. And then we do all the pressure points on your toes. They are all, the top of your toe, those sinuses, and then top of your toe is the brain, and then come down to the base of your toe is your thyroid. Then between the second and third toe is your eyes, and then between the last 2 toes is your ears. So all the pressure points. Then you come down to your lungs and your heart. Then you come to middle is your internal organ, digestive system, kidney, liver, and all that. And come down to the lower part of the body, your intestine, and all the others. And the side is the spine. And the front is the liver between your between your 2 toes, and then all the others as well. So you just give it a pressure point, rub it, and tap it, and then hold like a baby, and do it. Ha 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 ha.
Lovely.
Same with the other one, left leg, and then you breathe in, come down, again, down, one more, down. And then rotate. Be careful if you got bad arthritis and you can't move your joint. Otherwise, you will injure yourself. You can cause a lot of swelling as well if you injure yourself. More pressure points. Now the weather is good, so we can walk bare feet on the grass, walk backwards to, correct your spine, so don't fall. And then all the pressure point, we go in the middle, at the bottom, at the side, in the front. Massage it. Just massage it with the oil. Very good. And then walk like a baby. Ha 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 ha. Ha 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 ha. As we do butterfly, then we do. Again, this is good for the sciatic pain, pumping up your lymph fluid. Also helps to reduce the fat around your thigh and the waistline as well. Good. Then relax. And stretch again, and we do grinding. So if Linga Mudra, as Sarvanji said, helps to reduce the fat. So we're going to do 10 times and then 10 times reverse. So you breathe in as you go back, and you breathe out as you go forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And relax. Now open up your legs and we're going to touch the opposite toe. So people who can't touch the toe, just touch the knee or wherever you can and look back. So breathe in. And relax. You can do more. Now we're doing Makan 20 times. I'm going to count quietly. So make sure your back is straight and do whatever you can. You can do 10 times if you can't do 20 times. We start. And relax. Got to do Mandukasana.
Yeah, and then do hand exercise.
Take a deep breath if you're tired. And sit in Vajrasan or on a chair, or you sit on, just sitting there, whichever you find comfortable to sit. So we will do. So if you, this is Mandukasana is for prevention of diabetic, and also it's good for the digestive system. So it's good for everybody. And people who has diabetic must do it at least 5 times before the meal and do it 3 times a day. That will help to activate your liver and stimulate your pancreas so insulin can release. So we make a fist. So we put them forward a bit. And then you push between your navel. Then you take a deep breath. Then you breathe out. Then you come down, press that against your navel, come down slowly, and then you look up and do Kapalbhati for 10 times. And then breathe in and out and come up. We'll do it again. Breathe in. Breathe out. Come down. Look up. And breathe in and out and come up. This time I'm going to put it on the other side. So you put it over your liver, your pancreas, and left one on the spleen. So then you breathe in, breathe out, come down, and look up. And then breathe in and out, come up. Next, people who can't bend down. So right hand over your liver and pancreas, left over your spleen. Then you breathe in, breathe out, and then do Kapalbhati. And relax. Next, we'll do the massage or Kapalbhati if you want to. The left hand over your kidney, over your liver and your pancreas, and the right hand over it. You breathe in, breathe out, come down, look up, do Kapalbhati or you massage it. Do whatever you want to do it. And then breathe in and out and come up. We do one more time. Then come up. And then this time, right hand over your spleen, left hand over it. You breathe in, breathe out, and come up. Breathe in and out and come up. Next, we do a child pose. So breathe in, and then raise your hands and bend backwards. And then breathe out, come down, looking at your knees, just massage it. A few seconds. And breathe in and out, or come off. We do one more time. Breathe in, and back if you can, and then come down. And relax. We're going to do a half moon shape. We haven't done it for a few days. People who can do it, do it. Otherwise, don't worry. So sit on your knees, hand in the front, or you can put it on your waistline. So whichever is comfortable. Then you breathe in, your legs together, and then you bend back as far as you can. Hold in your breath if you can. And then breathe out. Do it one more time. Take a deep breath. Go back. And breathe out. Next, we do camel pose. We only do it one. So right hand over the right heel, left hand over the left heel. Then you come up. Hold your breath. So breathe in, hold the breath if you can. 2 seconds. And come down. Repeat for one time. And relax. We do along below. And then I'll stand by and do Ujit. Is that okay?
Yeah.
So we're going to,
Ujjayi.
yeah, we do the Halong Vilong first. And then if you sit in a Gain Mudra, you do Khichdi Mudra as well. Khichdi Mudra is you roll your tongue up and touching the roof of your mouth. It stimulates your vagus nerves so that will help you to calm down as well and concentrate on your third eye. So it gives you same benefits as Bhastrika as well. The sitting either have a Gain Mudra or Vayu Surya Mudra, the same. So whichever mudra you prefer, and then you close your right nostril, and then you breathe from your left nostril. This is a moon. So we're taking a cool air in, and then you close your left nostril, and then you breathe out from your right nostril, which is the sun. And then again, you breathe from the right nostril, taking the warm air, close the right nostril, and breathe out from the left. So you carry on alternate breathing. It's a 2.5 seconds to breathe in, 2.5 seconds to breathe out. But because you're doing alternate breathing, you're taking warm air and cool air, also giving your lungs a more time to spread the oxygen around your lungs. Taking a pure oxygen purifies the blood, giving you good brain functions. Heart delivers the pure oxygen to the brain first, and then to the rest of the body. This will help to unblock your blocked arteries. So prevents heart attacks. Increase your lung capacity, fight infections, release good hormones as well. Do it 5 minutes, 10 minutes. If you're suffering from any conditions, please do it longer. Start with a minimum from 2 to 3 minutes and increase to 5, 10, 15, and then carry on for half an hour, 1 hour, and it works. You need lots of healthy cells to fight all the infection and the disease. Again, it can be done any time of the day, any time before and after meal, standing, sitting, sleeping. We breathe from the right nostril. Then you breathe out from the left nostril. And relax. I do it a lot when I go down the beach. Sit in one corner and do it. Lots of fresh air on the beach, and you get your mind get fresh as well. So when you're walking along the beach, do this exercise. Never mind about people watching you. You can tell them it's good for you.
Yeah, that's great.
So we do Ujjayi, right?
Yeah, we'll do Ujjayi
Ujjayi, yeah.
and then Brahmi. So Ujjayi is 3 times breathe in with your throat. The last time when you breathe in, make a deep throat breathing in, and then you put your Jalandhar Bandh and hold it for a few seconds, and then close your right nostril, breathe out with your left. Okay, so we do it 3 times. And breathe out with your left. Again. And breathe out. You can hold it as long as you can and then breathe it out, okay? Again. And breathe out. And rub your throat. Good exercise for your throat. People who are singing, people who got thyroid, it's a good exercise for it. But don't do it if you have tonsillitis. Tonsils. Yeah.
That's right.
The next one is Brahmari. We'll do 3 times Brahmari. Close your ears with your thumb. Your 2 finger goes on your eye, index finger on your head, and you breathe in deep and then humming out. Breathe in. Keep your eyes closed. Rub your hands and put it on your eyes. Upon your eyes, and you do press up now. Hold your hands, put in the back, press it hard. Again, in the front, on the side, on your left hand side, and relax. We'll do Udgit 3 times in Gyan Mudra. Om 3 times. Okay. Back straight. Breathe in deep. Linga Mudra. Keep your eyes closed and meditate for a few seconds. Take all the weight of your shoulder, of your eyes, eyelids, in your mind and relax. Total relaxation. Deep breathe in and breathe out. Two to 5 minutes of total relaxation every day will help your mind, body and soul. Relax and rub your hands. Make it warm. Keep your eyes closed. Make your hands like a cup. Put on your head, on your eyes, and give a gentle massage to your eyes, your eyebrows. Just give a little pressing. Give a massage to your forehead, on the side. Also bring it down. Put your two fingers behind your ears. Give a nice gentle massage to your head. Press your ears. Go on your head slowly. Come back. And your throat. And your shoulder. And your hands. And your whole body. Let it relax. So that completes our session. So we will do prayer. Om Sarve Bhavantu Sukhina. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Ma Kaschit Dukbhag Bhavet. Om Shanti Shanti Shanti. May all be happy. May all be healthy. May all enjoy prosperity. May none suffer. Om Shanti.
To
Take a
Sinhasana.
roaring, roaring like a lion. Good for your throat. Good exercise for your throat and your speech and everything. So take that position of lion and we'll roar 3 times. Breathe in. And rub your throat. And the last one, be happy and give a big laugh. Well done, everybody.
Thank you for joining us today.
Thank you very much, Maniji and Kapur Bhai.
Thank you, Thakur Bhai and
Lovely
Maniji.
session.
Thank you,
Very
Maniji.
nice.
Have a
Thank
nice
you. Thank you,
weekend.
everyone.
Namaskar.
You